With the start of the COVID pandemic globally, CDC, building on our public health expertise, came up with innovative ways to ensure that service delivery was maintained, especially for our clients who we serve. Cameroon's HIV program had made significant advancements through CDC's support. We had worked to ensure that patients who were identified as HIV positive were put on treatments, and we wanted to ensure that that continued in spite of the pandemic. So we developed innovative ways to ensure that we were meeting clients where they were. We developed community strategies, including community dispensation, taking drugs to patients in their houses, community testing people in their homes or in the community, and if they were identified as HIV positive, ensuring that they were then linked to treatments. We implemented differentiated service delivery models, again focused on client-centered care. If clients were not able to come to health facilities, we wanted to ensure that they were still able to receive the quality of care that they had been receiving through CDC and our implementing partners. We also worked to ensure that the quality of services that we were delivering were maintained. And we did this through a continuous quality improvement program, GSM, granular site management, which typically had involved CDC public health experts going to health facilities, reviewing data in conjunction with health facility staff and Ministry of Health officials to identify areas for improvements. With the start of the COVID pandemic, we then worked to implement this in a virtual manner and had weekly granular site management meetings. And what this involved was review of data using virtual platforms, which brought together our CDC public health experts, our implementing partners, and health facility staff. We reviewed data on a weekly basis, identified areas where performance was good so that it could be continued, and also identified areas where there were gaps so that it could then be improved. And throughout the pandemic, we saw a continuous improvement in the quality of services as well as performance across all key indicators, including the number of persons who were identified as HIV positive, the numbers linked to treatments, the numbers that were virally suppressed, both among adults and our pediatric populations. And because of these adaptations that CDC implemented, we are getting closer to achieving our 95 targets and making Cameroon closer to HIV epidemic control.